So we would like to start with the first presentation, and this is Group 3, to present the results. And just to give you a short description of what happened in this group, we started with basically the same scenario. So there are a couple of outbreaks, and they're investigated, and they have a case of H5N1 in a hospital as a starting situation. The outbreaks in birds are confirmed as H5N1, so they have a couple of outbreaks H5N1 in birds. In a cross-border situation, you have human cases of H5N1, and then the unthinkable happens. You have a passenger from West Africa arriving with the symptoms of Ebola, and the test turned out to be positive. So the situation up to now is this country has outbreaks of H5N1 in animals and humans, and one case of Ebola, returning traveler from West Africa. So, and here's the group.
So maybe you introduce who will assign to work.
Okay. Good morning, everyone. Group 3 will present in all group members as all sectors: human health by Watana, animal health by Vinay, industry and trade by Chanari, public by Susu, and tourism by Panchawi, and travel by Sotia. So I like to call Watana for human health.
Good morning again. As you have a situation in your hand now for everyone, we have the same situation for the day one for everyone. In terms of, I am a representative from the human health. What I need to know from the situation for the H5N1. For the H5N1, the human health, like me now, I want to know about the pouty contact. The patient have a history of the pouty contact before they show clinical sign or not. They have like a eating pouty meat, or they contact directly with the pouty in the house or from the farm, something like that. And case contact is like the history with the contact with the other person in the family, in the committee, something. And the new case of the new case of severe influenza-like syndrome or H5N1, something like that. We need to know a more new case in this.
Good morning again. I am representative for the animal health. For this situation, we would like to know about the number of the chicken die, because we know only the chicken die, but we don't know exactly how many chicken die. And would like to know about the specimen they collect for the testing or not, because they don't inform us for the how many confirm or for this one. And also we would like to know about the area of the effect area, how many area, and the same area or not, or separate or cluster, or we would like to know sporadic or something like that. And control measure, what they do now for the control and for the movement or something like that for the from the animal sector. For another side, please.
Hi, good morning. I'm representing as a trader. For this situation, I'm acting as a chicken farmer. So the question I'm bringing up from the chicken farmer is, what will happen to my farm, and can we still sell our chicken or products, and is there somebody coming to taste our farm, and if our farm is our chicken is infected, do they need to be all killed, and if it's killed, who gonna subsidize us? What subsidies we gonna get, and if the trade is banned, how long we need to wait until we can trade again? Yeah. For the public.
Yes.
As public, we need to know, can we eat chicken and eggs, if raw or not well cooked chicken or eggs? And is there human to human transmission of this disease, and how to prevent, and what to do if we have signs and symptoms of these diseases, and what is the severity of diseases? Will we die if we have the disease? And what is the government plan to control these diseases? Is there enough drugs, or is there any medical equipments and human resources for effective care for the public?
Okay, good morning. I'm tourism. When we have the situation about for the we need to know is H5N1. We need for the situation update, and we need to the cross border, and we need to the for from human, animal, and trade for the situation at neighboring cross border and contact to the travel.
Good morning. This I am traveler agencies, so I should know that should we stop the traveling from the one place to other place, or from the outside to in the affected area, and the country's control is measurements. Is that finished?
Okay, after what information we need to know from each chapter, now we come up with the second question about what to do if we know about all the information on about the situation in terms of the human health. We want to know about do about the outbreak investigation. To ensure there is no new case of avian influenza H5N1 infection in the human, or any severe influenza like in the human infection. And we want to do is hospital case management and infection control for the hospital in case of the infected human.
Yes, for the animal side, we also would like to know about the surveillance, especially for the H1N9 we found in the Punti, especially either we can make about the surveillance, collect the specimen to test to identify the how many cases for the duck and the Punti, and we have to know I have to do about the control measurement for this Punti, and control about the movement and cellular or anything we should include for this situation. Yes.
And as a trader or a farmer, I still want my money back. So before I get somebody to come and taste our chicken, I would sell the healthy chicken, maybe in lower price, or something. And if somebody come and tasted us and found that there are some positive chicken in our farm, we're gonna follow the instruction by the Ministry of Livestock, and also, again with the money, also ask for the subsidy for all the loss we have.
The people, if in this condition, the people may avoid chicken, uncooked chicken and eggs, and we are aware about the signs and symptoms of the animal cases. Is there any hemorrhage in food, and if one acquired the symptoms like influenza, we may afraid and suspect is there influenza-like illness like H5N1, and will follow the advice by the Ministry of Health and the local health personnel.
For the toilets,
So maybe I will present also. as for my travel agency and tourism. So I will tell to my tourists to avoid to infected areas and promote the promotion the health form, health declaration form to the tourism, and follow the situation from the Ministry of Health or the government, and provide information to the tourists.
Okay. The third question, we are go to the what you wish to have in place in terms of the human health. It's like me. I want to be a doctor only. I want to have. Do we have enough medicine to support in case of there is a lot of case infected with H5N1? We have enough Tamiflu to stock in our hospital. Do we have do we have human resource, it's like a doctor or nurse to support at the hospital, or the person or health worker in the hospital, something like that? Do we have enough equipment like PPE or mask, something like that? Do we have enough of those equipment in the to support for the health facility? And we wish to have it like we wish to do it emergency contact for the each hospital or health worker or something like that. We wish to have it emergency contact, and we have to have like a SOP or policy commitment or SOP for the person who are working for the health, thing like that.
Yes, for anymore, we would like also wish to have about the resource, this meaning about the human resource and funding, and we also would like to have about the policy regulation for movement control or something like that, and guideline. Yes.
For the trader and farmer, we would like to we wish we could have guideline or information on how we gonna deal with how we should deal with this situation, and also the contact person, the contact number from each sector who we need to contact if in case of emergency.
As the community, we like to receive the trusted and updated information from the Ministry of Health, and we need comprehensive health care at the hospital, and also effective control and prevention measures.
And our team, we wish to the contact and guideline for the information and consultation from the each sector and the emerging contact.
So now, if you have exercise in your hand, you will see the situation is go bad, because in the day 5 we found 12 more positive outbreak in the for the party, and no, I don't know in the party or not. And the member the member in the same family show admit to the hospital and test for positive for H5N1. And more than that, we found that the traveler who come back from the West Africa, it showed the clinical sign of fever, headache, and vomiting, and she admitted to the hospital and testing for influenza. After that, in day 6, they found that those patients or those travelers is show positive for Ebola. Now we are facing for a serious situation. We are facing for the Ebola outbreak and H5N1 outbreak in the same time. In terms of the human health, it's what we want to do, right? Okay. What we want to know and what we want to do in terms of human health. What we want to have is we want to have it national level steering community or coordination who can coordinate all the stakeholder on the organization in the country to work together, something like that. And then we need to know about the contract person who have the same, who take the same airline with the patient who take the positive for Ebola. We know how many persons take that the same airline who sit behind or near him or she or her, something like that, and where she stay, where she travel, and then we want to know, we want to follow up the traveling after she landing, where she go, where she travel, something like that. We know we need to know about history of the traveling. What health worker? Yes. Yeah, we want to do a strengthening about surveillance system in the country, because now we are not only facing for H5N1, but we are facing for Ebola also. So what we are going to do is strengthening surveillance system, both disease, H5N1 and Ebola, and infection control for the infected case for Ebola and H5N1 in hospital. And finally is coordination and communication and collaboration or coordinate with the other sector. It's very important because we need to provide information to the other sector or work together very close with the other sector in terms of the outbreak of Ebola and H5N1.
Yes. In terms of the animal health, we also set up the team for the outbreak investigation and the surveillance both domestic and wild birds, and control the measure we should have for this part, and health education to the public, and link the information with the multi-sectoral and ask that's on for the animals.
As for a trader or farmer, we would like to know whether any other animal can be infected with these two diseases, and also if in case of infection, we would follow the instruction by authority, also ask for support by government, and in case of the farm that want some person to come to taste the animal in that farm, if possible, we would like to have a certificate, or somebody to certify that our farm is free from infection, free from diseases as well, to be able to sell.